It is now time for Ask the Expert. Today, we're talking about a chronic autoimmune disease called lupus.
Joining us live this afternoon, Dr. Felicia Robertson from Aurora Healthcare, and thanks for joining us. First of all, let's start off with a working definition of just what lupus is.
Sure. Lupus is a disease. It's a chronic autoimmune disease, meaning the body itself fights itself. Normally, our body does really well with knowing what's innate and what's foreign. So our immune system usually will fight against viruses or bacteria, etc. With lupus as a disease, it fights against itself. So many different organ systems can be involved as well.
So how common is this?
Lupus is pretty common. Almost 5,000 individuals nationally are diagnosed with this disease itself, and very difficult to diagnose due to the myriad of symptoms.
So what are some of the symptoms, and can they manifest themselves at any point during life? Can you all of a sudden get lupus later in life?
Generally, it's going to be during reproductive years. More women than men are diagnosed with lupus itself, but certainly because it can be complex to diagnose, one may have a delayed diagnosis.
Let's talk about some of the symptoms.
Sure.
What's the first one that you can think of that may say you might have lupus?
Sure. So lupus has a lot of different symptoms, but let's talk about some classics. Now, not that every patient who has lupus will present with classic symptoms, and maybe something like a rash across the nose and the cheeks. It may be that a person has light sensitivity with their skin. They may also have significant chest discomfort or shortness of breath, or fatigue, or decreased memory and concentration. So some of these symptoms can be a part of, any boring, part of life.
Now,
in terms of how many people come into my office and they say, Dr. Robertson, I'm tired. 99.9% at some point in their lives.
Right? But as time goes along, lupus can become very serious, even deadly, destroying organs, correct?
Absolutely. When I think of lupus as a primary care physician, the risk of having heart disease and strokes and kidney failure is extremely high. So it's important to work on making sure the blood pressure is controlled, cholesterol, if they're at risk for diabetes, healthier eating, and even with the pain, the aches and the muscle aches, trying to get them to move more as well.
So if someone thinks that they have lupus, quickly, what should be the first step?
Talk to your doctor, write down. I'm a fan of writing down your symptoms so that you can help your doctor to get to the point and diagnose you sooner rather than later. Of course, there's blood work to also be able to help diagnose patients.
That's Dr. Felicia Robertson, and she is an expert. If you want to email one of our experts and get a question on, just send it directly to AskTheExpert@today'sTMJ4.com, and you can also leave a voicemail. The number is 967-5253. Thanks a lot, Doctor.
Yes.